Christmas Day, 1956. A perfectly healthy mother gives birth to her daughter. However, the baby is born with malformed ears. She would just be the first of thousands to be affected by thalidomide. In this presentation, Group 9 will discuss how thalidomide became one of the worst man-made disasters. Thalidomide was first introduced in the late 1950s and early 1960s by a West German pharmaceutical company called Grünenthal. It underwent extremely basic testing, was considered a non-addictive, non-barbiturate sedative. It was used to treat many different ailments, including coughs, flus, nausea, and sleeplessness. Because it was so effective at treating nausea, many pregnant women reached for thalidomide when they had morning sickness. It was widely available and did not require a prescription to obtain. Thalidomide was marketed to 46 different countries, some of which included Japan, Germany, and Australia. It underwent many different names such as Contergan, Distaval, and Softenol. It did eventually lead to hundreds of thousands of malformations in babies because it was not yet known how this medicine affects pregnant women and how it can cross the placenta. Similar to how we have a left hand and a right hand, thalidomide has two different formations, the S enantiomer and the R enantiomer. In its drug form, thalidomide is given as a racemic mixture of these two formations. The R enantiomer is what gives thalidomide its sedative-like effects, while the S enantiomer is what gives it its teratogenic effects, which causes harm to the fetus. Thalidomide is a glutamic acid analog and prevents angiogenesis, which is the formation of new blood vessels. In modern times, it is used to treat tumors so that they don't steal nutrients through its blood vessels. It is hypothesized that preventing angiogenesis is what gives thalidomide its teratogenic effects because the fetus cannot form the blood vessels it needs to gain nutrients. This is what leads to the thousands of babies being born with malformations and missing limbs.
Hello, my name is Mirna Tobea, and today I will talk about the tragedy of the birth defect. Thalidomide was commonly used by pregnant women to treat nausea in the late 1950s and early 1960s. However, in mid-1960s, it was discovered that the drug was causing deformities in the newborns. More than 10,000 children in approximately 46 countries were born with deformities like phocomelia. Such disease can cause malformation in the arms and legs and many other parts of the fetus's body. The drug caused deformities depending on when the pregnant mother would take the thalidomide during her pregnancy. If the drug was taken on the 20th day of the pregnancy, it would cause central brain damage. However, if it was taken on the 21st day, it would damage the eyes. On day 22nd, it would cause malformation of the ear and the face. And on days 24 through the 28, it would cause deforms in the arms and the legs. Fortunately, thalidomide would not damage the baby if it was taken after 42 days of the pregnancy.
Let's talk about Dr. Francis Kelley, a key figure in the effort to ban thalidomide from entering the US. Dr. Francis Kelley was a PhD professor and taught in the University of Chicago from 1938 to 1950, and later taught pharmacology at the University of South Dakota from 1954 to 1957. And in 1960, she moved to Washington, D.C. to begin her career in the FDA. During her first month at the FDA, she took firm stances against thalidomide due to the dangerous side effects, peripheral neuropathy, which is just a disease that affects the peripheral nerves, causing impure sensation, movement, gland, organ functions, depending on the nerve it damaged. Additionally, she fought pharmaceutical companies for drug data regarding harmfulness to the fetus. As a result, in November of 1961, birth defects from mother who had taken thalidomide during pregnancy arise, and this further strengthened her resolve, and with the help of Dr. Helen Tussig's, the drug was finally banned in the US. In the aftermath of thalidomide, on August 7, 1962, Dr. Francis Kelley received the President's Award for Distinguished Federal Civilian Service for her effort in blocking American approval of thalidomide, becoming the second woman to be honored by the award. She continued on her work at the FDA and played a big role in creating the 1962 amendment, which required drug manufacturers to provide sufficient proof of effectiveness and safety of the drugs before applying for approval with the FDA. It also required drugs advertisement to disclose accurate information about side effects, stopping false advertisement of cheap drugs as expensive drugs, and also required consent from patients during trial and any adverse reaction to be immediately reported to the FDA. Additionally, she pushed to ensure the integrity of scientific data and clinical trial. This next slide is just a short video of Dr. Francis Kelley receiving her award. That's her right there. That's John F. Kennedy, President John F. Kennedy. And this is her receiving the award. So good, so great.
Hello everyone, I'll be talking about some current uses of thalidomide. After entering the market in 1956 as a non-barbiturate hypnotic sedative, thalidomide quickly gained popularity and was widely used across the world until it was banned in 1961. In 1964, Dr. Jacob Schizkin discovered that thalidomide was very effective in treating erythromonadosum leprosum, or ENL, a severe skin disease. This case was reported in 1965, and from then on, a series of studies were published on anti-inflammatory and anti-angiogenesis properties of thalidomide. After conducting large randomized trials, thalidomide was approved for treating ENL by the FDA in 1998. As for its anti-angiogenesis properties, although the hypothesis of using thalidomide in cancer treatment was proposed in the 1960s, shortly after the drug was banned, it was not until 1999 that the first successful application of using thalidomide in plasma cell myeloma was reported. This attempt was made with single-agent thalidomide. In 2006, thalidomide was approved for treating newly diagnosed plasma cell myeloma combined with another molecule, dexamethasone.